And the first is a presentation by Ms. Jillene Visser van der Merwe.
I pressed the big green button, or the small one, or both. Okay. Thank you. Good day, everyone. My name is Jillene Visser. I am the laboratory animal technologist working at Merwe, alongside with the PCIF team, where we are involved in small animal nuclear imaging. My presentation will be on anesthetics that are most suitable for PET-CT radiotracer imaging in small laboratory animals. During PET-CT imaging, it is required for the animal to be completely still during the imaging procedure to prevent movement artifacts during the imaging process. Anesthetics can have a profound effect on the physiological systems of the animal and can influence the blood glucose levels, the organ metabolism. It can lower body temperature, and it can also cause severe cardiac and respiratory depression. Here on this slide, we see the two anesthetic compounds, injectable versus inhalation. There are various anesthetics available on the market. You can either use the injectable anesthetic, which poses a higher risk because once it is administered, it is very difficult to adjust the depth and duration of the anesthetic in the animal. And there's also the potential risk for overdose, which can increase your mortality rate. And also, if the animal is successfully anesthetized, the recovery is still long, and you will most likely need a pulse oximeter to monitor vital signs. And in some cases, for instance, when you have a BSL-3 facility, the potentially infectious animal must be contained. So inhalation anesthetics is not always a viable option. So a good injectable alternative needs to be used. Also, what I just want to mention before I go to this slide, inhalation anesthetics is safer and for the animals, and it causes a lower mortality rate because of the quick recovery time. And it also has a adjustable depth and duration in the animal. And inhalation anesthetics also poses a lower interference with the radiotracer metabolism. And it also, which is fortunate, it has a quicker recovery than the injectable anesthetics. On this slide, the aim we have here on these three images you see here of three common radiotracers. Usually for PET-CT imaging, the duration of the procedure is 60 minutes long. So you need to use an anesthetic that will keep the animal anesthetized for that period of time. So you can also see the common radiotracers that we are investigating. 18F-FDG, 68 gallium dotatate, and 68 gallium PSMA. So the information, or basically literature on anesthetic effects of anesthesia on PET-CT imaging in small animals is very limited. So I mainly focused on the following parameters, that is respiration rate, body temperature, heart rate, and glucose metabolism. I created a summary for the most suitable anesthetics for PET-CT imaging using the common radio tracers. I've got my inhalation anesthetics there at the top and my injectables there below. And this is just to summarize the anesthetic effects on the animal physiology. So red indicates high physiological interference. Orange indicates an increased safety risk to the animal with moderate physiological interference. And green indicates low physiological interference, which is a good, safe anesthetic option to use. Also, you see there by ketamine and xylazine, the block there is highlighted in red. Ketamine and xylazine induces hyperglycemia in small rodents used for PET-CT imaging, especially when you use FDG studies. So we completely avoid the use of that injectable anesthetic. We would rather use anesthetic like isoflurane. And later we will also see good alternatives for injectables that we can use for FDG scanning. But for radio tracers, dotatate and PSMA11, you can use ketamine and xylazine because they are not glucose analogs. So you can use them with ease without any physiological interference. So isoflurane is the most commonly used anesthetic through the bank, but there are some more suitable alternatives available depending on the tracer you are using. Now for dotatate, caution must be used because isoflurane increases the glucocortico levels and neuroendocrine abnormalities in the blood plasma, which makes it difficult for dotatate to bind to the SSR2 receptors in your neuroendocrine studies. Let's just look at that option. But isoflurane is ideal for FDG. It renders the animals hypoglycemic, which is good for increased target uptake at desired target areas, as it lowers the blood glucose levels. Pentobarbital and propofol are also suitable agents for FDG. Pentobarbital poses a greater risk because of the increase in respiratory and cardiac depression. So you must most likely use a pulse oximeter to monitor the animal while the animal is under anesthesia. And these two agents don't interfere with the glucose metabolism. Pentobarbital is a long-acting anesthetic, where propofol is a short-acting anesthetic, but propofol is not suitable for cerebral FDG imaging because it lowers the glucose metabolism in the brain. The best option for injectable anesthetics for FDG is fentanyl citrate fluanazone in combination with diazepam. It doesn't have any interference with the glucose metabolism, but unfortunately it is a highly regulated drug and we struggle to get it in South Africa. So if there's anyone out there that knows some ways how to get it into the country, please let us know. Obviously in a very legal manner. Yeah. So that we can see what a good protocol refinement and improved imaging quality we can do with injectable anesthetics regarding FDG imaging. So I'm coming to my conclusion. Anesthetics used for PET-CT imaging. It is important to use the correct anesthetic that is a perfect match with your radio tracer that you are using for imaging purposes. You now know there are some alternatives out there that can be used, and hopefully it can assist you in improving the imaging quality for your future PET-CT studies. And I'll leave it there. There's some of my references. You can come and talk to me if I can provide the references to you. And I want to give a special thanks to Numerai, my employers, and Nexa, and the PCIF team, which, yes, couldn't have done it without them. So yeah, thank you very much.